And now to continue our conversation on the future of the AST is President-elect Dr. Jon Kobashigawa, who joins us here in studio. Pleasure to have you with us today.
Great, glad to be here.
Well, first, congratulations on this position. You start officially tomorrow at the helm. Can you kind of start with what exactly your role as President-elect entails? How do you serve the organization?
Well, it's threefold actually. It's to support the president in all of his or her activities, but also to head the board of directors when the president is not present, and to be aware of all the organizational issues that do occur, and finally to be on the executive committee that makes a bulk of the decisions for the society.
As President-elect, what have been some of the key priorities for you during this past year?
There's been decreased interest in transplant careers, and we're trying to increase that by forming a transplant workforce and task force, in other words. And we've actually had roundtable discussions, and we are coming to produce a toolkit as to how we might be able to increase interest in a career in transplantation.
Any guesses on why there might be a diminished interest in a
know,
career? That's the million-dollar question.
We've actually looked into that quite in depth. Most of it is opportunities in transplantation, and mainly because there are not that many academic positions that are available. The other thing is, and I hate to say this, but lower compensation. If we could increase compensation, that would be great. And finally, it's a generational thing, I believe, and that is the work-life balance.
Absolutely.
In transplantation is quite in depth and intense in terms of the acuity of our patient populations. And so that too is a disincentive actually to spend more than adequate time in the hospitals taking care of these patients.
All factors that matter, for sure. As you start to take over as president of the AST, what are some key policies or priorities that you would like to implement during your term?
One of the big things that we're looking at is taking care of end-stage organ disease. And this is something that is pertinent to all organs per se. We make decisions about when to go to transplantation, but there are alternatives too. We know xenotransplantation is coming down the pike right now, but also in terms of artificial organs, that's really coming to light too. Total artificial heart, for example. But also there's stem cell therapy, there's a whole organ engineering, and these are really exciting areas to pursue.
Incredible. Great options there. How important is collaboration with the ASTS, and why do you feel that this joint Congress is beneficial to your members?
We have the same focus, and that is really treating patients with end-stage organ disease and transplantation. I would like to see us even work more closely together, because we should have one unifying voice in the government in terms of legislative issues that are coming to light. For example, the Living Donor Protection Act is something that we'd really like to push through Congress so that we can protect donors so that they don't lose their health insurance, they don't lose time on the job, they have some time to recover. And there are many other, the immuno bill to provide immunosuppressive agents for our patients. And finally, we work together, the AST, ASTS, for our combined journal, the American Journal of Transplantation. And that is truly our mission, and that is to expand knowledge in our field. And at the end of the day, that will help to improve outcome for our patients.
Congratulations on your new role, and best wishes for a successful term.
Thank you so much.